am now the group owner or the group runner of NAMI on this campus. What I was going to ask you is what you thought or what you know already about borderline personality disorder. Is there anything that you automatically, when you think of that word, comes to your mind, or what you think it might be, or what you know it might be? No. Okay, so
Nothing comes to mind.
Nothing comes to mind.
Yeah.
So, borderline personality disorder is a mental illness marked by unstable mood swings and behavior in relationships. It's often very misdiagnosed and often very confused with bipolar disorder. So, it's really kind of hard to diagnose. Also, there's not one test that automatically says, okay, well, you have borderline personality disorder. And since it does overlap a lot with bipolar disorder, it's really hard to distinguish who has what, because it is so similar. Experts, I've done research and it says experts now think that borderline personality disorder is not the correct name that should be used for it, because borderline, it's like misleading as to what it really is. So far there's not a name that they come up with, because when you do look into it and research more about it, you see that until around 1980, where it started to get more recognition, people in the mental health field didn't even recognize it as a valid psychosis, because they thought, oh, well, this might be bipolar disorder. And after I explained to you some of the symptoms about BPD, you will realize how easily it gets that misdiagnosed or often goes untreated. So what BPD is, it's problems with regulating your emotions and your thoughts. It's very high highs and very low lows. It's impulsive and reckless behavior, and it's also unstable relationships with other people. A mental health professional can diagnose it. It's not, like I said, it's not easily diagnosed. People often misdiagnose it. So you really have to, you just can't go on WebMD and figure out, oh, do I have this, this, and this? Because the symptoms are so overlapping with other mental illnesses. And by a medical professional who does diagnose of BPD, they will look at your family history, they will look at your history of things that you do. It's a lot of one-on-one therapy sessions to kind of figure out what is going on, how do we diagnose this, and that is if people are coming forward with all their symptoms, because they might say, oh, well, I just have this, and then leave out other things. They might not bring the attention that it needs. Some other illnesses that is associated with BPD and that can overlap are things like depression, anxiety, eating disorders, so many things like that. And when you hear high highs and low lows, most people automatically think of bipolar disorder, because that's usually how bipolar disorder is talked about, having extreme highs of emotion and then having extreme lows of emotions. Right, which is also, I want to say, a stigma of how it's represented, because it isn't always like that. It is different. It is different for everyone. And that's why when I was told about doing this presentation, I thought, well, okay, I could go online, I can read a book and see the symptoms of it and see, okay, what does this expert say, what does this medical person say? But what I wanted to do was reach out to some of the friends that I knew who had been diagnosed with PPD and ask them what it's like for them because it varies on people. Every mental illness varies on people because we all have different brains, we all have different ways of thinking, emotions, things like that. So it's not going to be just textbook, oh, I have this, this, and this. I need this treatment because I have these symptoms. So what I did was I talked to my friend, I'll use another name, Hayden. I talked to him. And what Hayden had told to me is that he does have those highs and those lows, but some other things is he's a big fan of this actor, Anthony Perkins, who's in Psycho. And he said that 1 minute he would be talking about him, about his work, doting on him, having his posters on his wall, things like that, just enjoying his movies. And then she described it as something kind of clicks or something triggers a response from her or from him, where 1 minute he's talking about how much he loves his actor, the next minute he's tearing down the posters of his wall. He's talking about how much he hates him. He can't say his name because it would just enrage him because he does not want to talk about it. And he doesn't want to talk about the actor. He doesn't want to talk about anything associated. And then the next minute he's talking about how much he loves his actor. So it's kind of extreme high, extreme lows. That's just one example of one situation. And then a study, which is done by the NCSR, which is the National Camaraderie Survey Verification, which is the largest national study of mental illness. They did a study and they determined that about 85% of people with BPD also fit the diagnostic criteria for other illnesses, such as eating disorders, depression, things like that. And some physical symptoms are also high blood pressure, diabetes, back pain, arthritis. So you can kind of see how easy it is for things to overlap and for mental health professionals to say, oh, well, you have depression. It's so easy to say, oh, well, you have depression, here's this medication for that, but you're not getting the medication for what you're actually suffering from, because it's so easy, or it's so easy for them to get diagnosed as having bipolar disorder, and then they get the wrong kind of medication, and it throws them off even more to where they get off that medication and probably have a stigma of what medication does to them because they're not getting the correct things, the correct treatment that they need. With women who have BPD, they could also have eating disorders and high anxiety. So they could be getting treatment for those things, but not the rest of the symptoms. And for men, it's usually antisocial personality disorder, which is another very highly stigmatized disorder, and also substance abuse. Like I said, there's no single test to diagnose BPD, so it is very hard for people to actually get diagnosed with that because it is so often misunderstood and often stigmatized. I had some resources, some websites that I can give to you after this, but it helps with families, with caregivers. I think a lot of people think about the person who's ill, which they should, because that person's ill, but also think about the caregivers who have to raise an ill child or deal with an ill family member. And I want to speak on some of the problems that caregivers have. They could have sleep deprivation, poor eating habits because they're not taking care of themselves, failure to rest. They can postpone or fail to make their own medical appointments because they're so worried about the person they're trying to help that they're not helping themselves. And there was a quote that was said, in am I doing my best to help the person that I care about if I'm not helping myself? And so you can't really help someone else if you're not up to yourself. You're sick, you're trying to help a sick person who goes sick. Someone needs to get some type of leeway on that. So for some tips for caregivers is identifying personal barriers where it's, okay, I'm not gonna let you make me not do the things that I need to take care of myself. Like, I love you, things like that, but I need to take care of myself so I can help you. And some tips are to manage stress. That way, if you're a stressed out person and you're trying to help somebody else who has a mental illness, you don't want to get them stressed, because then their symptoms will heighten even more. So it's going to just make it worse for everyone around, and nobody's going to get the help they need. 2 is setting goals, taking breaks, having your own personal things that you want to accomplish, whether it's small things like, I want to finish this book, or I want to be able to go grocery store shopping by myself so I can get things that I need in peace, or things like that. It's little things, those little accomplishments that will help somebody de-stress. I know with the school year, a lot of people like, oh, well, I just need to go decompress, take a nap, listen to music, do something for myself. And that's one way that you can de-stress. Number 3 is seek solutions. I think a lot of times, not only is it doctors who don't know how to deal with a mentally ill patient, but it's also family members. That's why in NAMI, we talk a lot about not only getting help for those who are sick, but also getting help for the family members, so they can be able to help the person or their loved one that is sick. Because if they don't know anything about what this person is going through, they're not going to be able to help, no matter what. They're going to want to, and it's going to be in them, but they're not going to have the tools to be able to help the person that they're trying to help. So that is seek solutions. Go outside, ask for help. If you're going to need it. Everybody needs to ask for help. Don't try to fix it. I think a lot of people have that, oh, I can fix it. Nobody knows my loved one better than I do. But they kind of have to think, well, nobody knows this illness better than someone who studied and got the degree to learn about this illness. And 4 is communicating constructively. Being able to communicate with someone who is sick. Sometimes it's not always easy to do, especially depending on what mental illness that they do have. Not everything is very cut and dry, like, oh, well, if someone has depression, oh, well, we'll just do something to make them undepressed. It doesn't really work like that. So communicating constructively, that way you can be able to help that person, and it's just another tool to help. Also, talk to medical professionals. Make sure you have a regularly communication with that professional. I know there's some people who have that, doctor-patient privilege, but you could also talk to professionals and ask them, what can I do to help this person? You don't have to ask for the information. You can't unless they are allowed to. But you can always talk to a medical professional and ask them, what can I do to help? I'm doing this. Can I be doing something better? Things like that. Also, learn from your emotions. Understand what is happening. I think that's especially important with someone with BPD, is to understand your emotions, because they do have erratic behavior sometimes and heightened emotions. So if you don't understand your behaviors and you're trying to help this other person understand their behaviors, it's not going to work. It's a lot of patience, and it's a lot of understanding, and it's a lot of communication. There are four therapies that help with BPD. One is CBT, which is cognitive behavior therapy, and it's to help people see the different situations in relationships more clearly. It's the most effective that studies have shown, because it is that one-on-one therapy to really understand what that person is going through and how they can use their emotions in a positive way and not react so negatively. Because if they're reacting negatively, when they're interacting with someone else, it's going to be harder for them, because they're not understanding their emotions, they're not understanding what someone else may be thinking. They don't have that, I don't want to say that they don't have empathy, but it's kind of lacking. It's where they understand it, but not as well as we would. Like if I said something hurtful to someone, I would understand that it would be hurtful. Where someone with borderline personality disorder might think, oh, well, it's justified because, and they'll rationalize it in their mind. So it's something that it's again that open communication, that's talking, that therapy, understanding, and really trying to understand what other people are thinking as well as yourself. Also, there is medication, which I think for this disorder, this personal opinion, that might be the last thing on the list that someone should do. It depends on how severe it is, but I don't think it's, as for NAMI and for someone who's trying to stand up for mental illness all around, I feel like it's easier just to go for medication. Like, oh, I'm feeling this way. Okay, we'll give you medication. I feel like when you give medication to someone who has such impulsive behavior and such high-risk behavior, that it could become a dependency. And I feel like that's why a lot of mental illness people that I have researched fall on drugs, because it's kind of easier to deal with. But then that's just a personal opinion that I've done with my research. Maybe I'm wrong. Maybe I need to do more research. But that's just something I think. I think medication, to medicate it, it's a last step, depending on the severity. Because medication can mess with your brain. So if you have mental illness and then you have hard medication, I just feel like that's two negatives not making a positive at all. There's a lot of stigma around, especially mental illness in general, a lot of borderline personality disorder. One of them is it's not a valid psychiatric diagnosis, which I talked about in the beginning. It is a disease. It's not the same as bipolar disorder. The difference between, I believe, bipolar disorder and BPD is that with with bipolar disorder, you still have your core self. It is your moods that really change the most, but you still have your core self and your core thinking. Whereas with borderline personality disorder, it's very erratic. It's you don't have that sense of self really when you're in one of your episodes, as they would be called. Another one is almost everyone who has borderline personality disorder is a woman. That's not true at all. Maybe more women are, I did see that more women are more likely to come and get help and seek help than men are with this mental illness. I'm not sure if that goes for every mental illness, but for this one, that was one of the things that I read, that maybe that's why people have that stigma of it only being women, but it's not true at all. No, I think everybody can agree that no mental illness is gender favored. They don't have a favorite gender. Not one thing doesn't affect just one person. Another one is cannot be diagnosed accurately before the age of 18. That is something that I found that a lot of people have a lot of opinions on whether someone should be diagnosed before 18 or after 18. With this mental illness, signs usually show during puberty or after puberty, and that's why I think it is beneficial to go to therapies first and talk about it and get diagnosed that way instead of going straight for medication. Because I don't see it being beneficial for a 14-year-old, 15-year-old, things like that, being on medication. And even if they did or they weren't diagnosed before 18, that could cause a lot of problems that could be treated earlier had they done the therapy and actually been diagnosed at an early age. It's very controversial whether before 18 or after 18, whether people should be diagnosed with any mental illness, especially something like this, because it does overlap with a lot of other things, with like eating disorders and depression and anxiety and having symptoms like diabetes. Those are some of the physical symptoms that can occur and usually do occur because they're having bad eating habits and things like that. So, and it falls into eating disorder. So it's very overlapping, and that's why it's very hard to diagnose, because there's so many symptoms that really cross over, and that's why I looked up when I was doing the research on borderline personality disorder about what was the difference between that and bipolar disorder, because when I was reading, I was like, oh, well, that kind of sounds like bipolar disorder. I haven't done as much research on that, which is something that I plan to do next semester, now that I know that they are so similar. It is, and also the other stigma is it doesn't, borderline personality disorder does not respond to treatment, and I think that is also another reason, because since it wasn't really thought about as a valid diagnosis until 1980, people don't even really know how to treat it, and since it is confused with bipolar disorder a lot, people don't really know how to treat it as much. So I do think that the more people learn about it, about this disorder and mental illness in general, that it will open the doors for better research and more effective research and ways of treatment. And also, like I said, with bipolar disorder, you have that core identity, and with borderline personality disorder, you don't. There was, Hayden, I'll use him again, said that there were times in his low days or periods where he didn't feel as if he existed unless he was around other people. So you kind of lose that I need other people to feel like I matter. Whereas people with bipolar disorder have that core self, and their mood swings are more up in the air as opposed to how they feel about themselves and those negative feelings that they have about themselves and towards other people. And so I do think that we should all learn about mental illness, whether we have it or not, whether we suffer with it or not, or have a family member who suffers with it or not. Regardless of your major, there have been people who say, well, oh, I don't have that major, I don't really know about it. Well, I feel like you should, because your mental is everything. Your mental is who you are. And so any little thing, if anybody's taking a psychology class, any little thing can mess up your mental state. Like any small any traumas, things like that, anything can really throw you off. So if you don't know about how your brain works or how your emotions are, and you don't have anyone to talk to and you keep that bottled up, it's going to be very hard for you. Where opposed to it could be easier or treatable to live in today's society opposed to you just being bottled up. And then people will get that stigma from you and try to blame it on the person who is ill when it is not their fault. It's just they don't have the resources and things like that. Thank you for your time. I hope you do learn more about this disorder and all disorders, because it is really interesting, especially seeing as how it overlaps with a lot of other diagnoses.